Hi everybody, this is Michael McEvoy, and I love to talk to you today about the importance of electrolytes. As a nutritional consultant who works with many people all over the world, I see more and more common these days that a person is depleted of electrolytes, and this can be reflected in a basic blood test. So, electrolyte insufficiency or electrolyte excess or imbalances in electrolyte activity have a number of implications for a lot of the symptoms that some people are experiencing. The importance of electrolytes are one of the most fundamental issues of how the body functions. It's a fact that the cells of the body must maintain an electrical charge in order for the cells to work properly. And so this is the primary function of the electrolytes. So there's a number of implications that exist if your electrolyte levels are out of balance. So for example, the major things that a person may be experiencing with regards to poor electrolyte function are poor digestion and assimilation, adrenal gland insufficiency or adrenal gland stress, as well as nervous system, autonomic nervous system imbalances, and hydration issues. So first of all, let me say that there's a number of critically important electrolytes that are obtained on a basic blood test. And these are sodium and potassium, chloride and bicarbonate, calcium and phosphorus. These are the primary electrolytes that are routinely tested on most standard blood tests. So the ratio between these electrolytes are ultimately more important than the individual electrolyte levels themselves, but there's very specific ways to be able to determine if there are problems going on by looking at individual electrolytes. So let's take a look at the importance of gastric acid, stomach acid, and how the electrolytes fit into the equation. So first of all, digestive issues are a very common and increasingly common issue today, and they have a direct relationship to the electrolytes. Why is that? Well, if you look at two primary electrolytes, sodium and chloride, these two electrolytes are what the stomach needs in order to make hydrochloric acid. And so if there's depleted levels of sodium or chloride, there can very well be depleted levels of gastric acid. And so this is a major issue. So this is something that can be routinely screened on a basic blood test, is low levels of sodium and chloride. So you may ask, well, how does a person get depleted of these electrolytes? Well, first of all, if you're very physically active, if you're sweating a lot, if you're doing a lot of excessive training, if you're doing a lot of physical activity, it's very easy to become depleted of these electrolytes. If your diet includes very low salt intake, this could be a problem as well. If you have some toxicity with your kidneys, this could cause an impairment with the retention of sodium, meaning that the body may be excreting more and more chloride and sodium if there's a toxicity present in the kidneys. So these are common causes of what may precipitate an electrolyte depletion. The other critical function of sodium and chloride and potassium have a lot to do with adrenal gland function, influence the adrenal gland activity, cortisol production, aldosterone utilization and production. So sodium is critical for maintaining normal levels of mineralocorticoids. And conversely, mineralocorticoids influence sodium activity. Mineralocorticoids cause the retention of sodium, the excretion of potassium, so this has a lot to do with the pH of the body. Sodium, of course, is a base. Chloride is an acidifying mineral. And so if there are problems with adrenal gland activity, if there's low levels of adrenal gland output, typically the sodium level will be depressed and the potassium level will tend to be, in relation to the sodium, the potassium level will tend to be increased. Conversely, if there's excessive adrenal gland activity, high levels of cortisol, you may see the opposite situation. You may see high levels of chloride and sodium and depleted levels of potassium. But there's all kinds of combinations that could exist as a result of high or low adrenal gland activity, and a whole blood test is necessary to get an overall picture. But the point to consider is that the electrolytes play a very important role in regulating adrenal gland function and adrenal gland output. So the other thing is that the autonomic nervous system can be influenced strongly by electrolytes, and this may be especially the case for calcium and phosphorus levels. Research from 60, 70 years ago, done primarily by Melvin Page, who was a very famous nutritionist, dentist, determined that the calcium to phosphorus ratio had an enormous role to play with the autonomic nervous system balance. And so if the ratio is high or low, this could indicate high or low sympathetic or parasympathetic nervous system activity. So electrolyte activity is so important for your overall health, and it's always important to understand what you could do to help maintain ideal and optimal levels of certain electrolytes. It obviously can become a very complex issue, and so you oftentimes need to consult with an individual or nutritional professional or somebody that has an understanding of how to interpret a blood test and what to look for with regards to adrenal gland output, with endocrine activity, with electrolyte function. So I'm happy to announce that on Thursday, August 2nd, 2012, in Chicago, Illinois, I'll be giving a 2-hour PowerPoint presentation on Blood Test Interpretation 101. And this is going to be a phenomenal, comprehensive presentation for the layperson as well as the health professional, the alternative healthcare professional, or if you're a personal fitness trainer or a corrective exercise specialist. Wonderful information, very comprehensive. So please go to my website, www.metabolichealing.com. Many articles on electrolyte activity, hundreds of other articles as well on other related issues. So thanks again for watching. We'll talk next time. Take care.